Welcome to Beauty Talk with me, Cindy Nell-Roberts, and my beauty bestie, Denise Zimba. Our topic today is all things hormones, periods, menstrual cycles, and menopause. We are very fortunate to be joined in studio with our expert gynecologist, Dr. Celesté van Drünick, who specializes in oncology and is dedicated to helping women with their hormones. Dr. Celesté, welcome and
Thank you very much. Glad to be here. Thank you.
We are all very excited about this topic as women. So I think let's start with the basics. Talk us through the menstrual cycle. For those of our listeners who don't understand the basics, everything.
Okay, so let's say hypothetically a menstrual cycle is 28 days long. The first day of your period is when your menstrual cycle starts, and that's day one, not the end of your period when you stop having any bleeding. So that's day one. That's when the endometrial lining, the inside lining of your womb or your uterus, gets expelled because you're not pregnant. And so in the first 2 weeks when that happens, but also after that, you are in your follicular phase where you are estrogen dominant. So you've got lots of estrogen on board. Your brain signals to your ovaries, we need to find a dominant egg cell or follicle, we call it, and it stimulates that egg cell to mature. That egg cell starts secreting estrogen, which then gives you lots of energy, and you feel great in that first half of the cycle. And then on, hypothetically, day 14 in the middle of your cycle, but that can vary, you ovulate. When that egg cell is mature, your brain sends another signal, an LH hormone, to say, okay, ovulate, and you release that egg. And then you enter your second half of your cycle, which we call the luteal phase. So the area that stays behind in the ovary from where you ovulate, it forms what we call the corpus luteum, and that's why we call it the luteal phase. That corpus luteum secretes progesterone, which in the second half of your cycle can make you feel a little bit more tired, a little bit more moody, a bit more bloated. And then it also changes your endometrial lining to be more habitable for an embryo to implant. But if your body realizes you're not pregnant towards the end of your cycle, your estrogen and progesterone drops significantly, to very low levels. That's why you have PMS, you really don't feel well, you feel very tired. Once again, you're at your moodiest. And then when you're not pregnant on day one, the cycle starts all over and you start your period again.
Okay. So the body sheds the blood because it realizes it
it's
hasn't
not
made
pregnant.
a baby.
It's preparing the endometrial lining like a little nest. And then in the second half, it realizes, oh, okay, we're not pregnant, so we have to shed it, and it starts all over.
So when you do have your periods, so for me, I can sometimes have very heavy periods. Like, what causes that, and what can you do to prevent the heaviness, especially the first day, second day? Sometimes when I'm sleepy, it's so uncontrollable that I have to wake up at least every 3 hours just to, touch up and not miss, you know what I mean? So
any menstrual bleeding that's really affecting your life, whether it is socially or you can't go to work or school, is really something that you need to have checked out. If you can take a Nurofen on day 1 or 2 of your period, and you can manage with the pain, and you don't have to get up at night and continuously change your sanitary products, then that's fine. But as soon as it's affecting your life in that way that it's so heavy or so painful, you need to see someone, because there could be something, more sinister going on. There are many different reasons for heavy bleeding, menstrual bleeding, or very painful menstrual bleeding. From fibroids, endometriosis, adenomyosis is another condition, and that's something that you need to rule out case by a professional.
Speaking of fibroids, I suffered from fibroids, but I think there's a misconception that fibroids and endometriosis kind of fall in the same hub. And I'm kind of trying to discover that, because when I got you call them cysts, out, it got better. My flow got better. Intercourse got better. And just like the pain got better. So is it the same? Does it fall in the same hub from fibroids and endometriosis? Are they completely separate?
They are completely separate diagnoses and conditions, but people link them because they both can cause very heavy menstrual bleeding and very painful menstrual bleeding, which we call dysmenorrhea. Fibroids are like muscular growths or muscle balls that get formed in your uterus or your womb But nobody really knows why. Lots of women get it. You don't necessarily need to get them removed unless they cause you problems or symptoms like in your case. Endometriosis is a condition where the endometrial lining, the tissue that's supposed to be only on the inside lining of the uterus, starts growing on the outside. So whether it is on the ovaries, on the outside of the uterus, at the back of the uterus. But that causes a very strong inflammatory reaction, and that can then cause severe pain, heavy bleeding on your period, but also chronic pelvic pain the rest of the month. It has been associated with infertility as well because of the scar tissue that it causes. So these are different things, but they can have the same symptoms, and a professional needs to diagnose and rule them out.
How can you find that you potentially might have endometriosis?
So if you're experiencing any of these symptoms, so heavy bleeding, severely painful menstruation, but also pain not only on your period throughout the month in your pelvis, or you have that and you're struggling to fall pregnant for a while, that could mean that you have endometriosis. There could be other reasons also. Then you need to have it checked out by a professional.
So while we're on the big words, can you also explain to us what is PCOS and PMDD?
So PCOS is polycystic ovarian syndrome, and that is diagnosed if you have 2 out of 3 criteria. Polycystic ovaries on ultrasound, which is diagnosed by a doctor or a gynecologist. These are not cysts that you need removed surgically. They're very small, but they stay in the ovary, and that's where you haven't ovulated from, and they form little cysts that are hormone secreting. The second criteria is if you have prolonged cycles or no menstrual cycles at all. So you have very long cycles, or you even skip periods for months on end. That's the second criteria. And the third one is if you have elevated androgens, male-type hormones, that causes severe acne or unwanted hair growth on your body. So any 2 of the 3 of those criteria can mean that you have PCOS.
And PMDD?
PMDD is something completely different again. It's premenstrual dysphoric disorder. It's a severe form of PMS. So it has mood symptoms where you feel irritable, very depressed, anxious even. There are many mood symptoms. You can even have physical symptoms like a severe headache, bloatedness just before and on your period. But it's so severe that it affects your quality of life and your functioning. You can't go once again to school or work, and you can't function.
And the treatment for that?
There's different things that we can do. Conservative measures definitely includes exercise, eating a healthy diet, drinking enough water, sleeping enough. Mindfulness is very important. Things like yoga can also help you, walking. And then there is a place for medications, either hormonal, if you're interested in that, can definitely help, or something else like an antidepressant can even help with that.
Speaking of antidepressant, because I have a friend of mine who has a lot of stress, and she struggles to manage her stress. And I've realized that, and she's realized that it actually affects her flow, which I didn't know, because she sometimes has moments where she's spotting, but she should be on like, quote unquote, heavy flow. How can you prevent that? Is it just antidepressants to just allow the flow to flow? Even when you're going through hardships? Is it like, because a lot of people are always shying away from antidepressants.
No, of course, yes. I'm not saying that that's, the only treatment there is. If you're flowing at different times of your cycle, there's probably something else going on, a different reason. Either you're not ovulating regularly, or you have some growth or something that's influencing that in your womb. And so that is something that you need checked out. And it's just when the mood symptoms are quite severe, or the PMS and you have PMDD, that we then would maybe use an antidepressant. But there are many other measures you can also take to prevent that.
Talking about moods and the flow changing, it's sounding like your menopause years also, similar signs. How do we know when menopause is starting?
So symptoms of initially, sometimes women's cycles become more closer together, and then they actually skip and start becoming longer and longer. Of course, the hot flushes or flashes is a very big symptom. A lot of women, not all, luckily, but a lot of women experience. Insomnia, so you can't sleep, you're just struggling, your mood is changing. A lot of women that I see get diagnosed with depression around their menopause, but they actually just have severe menopausal symptoms. Other things like hair loss, collagen loss in your skin, so so you can feel very dry in your vagina as well. That's another symptom. Yeah, so there are quite a lot of symptoms that you can be on the lookout for. The average age is about 51, so a little bit before that or after that, if you're experiencing these symptoms, could be that you're going through menopause.
But the important thing is to visit your gynecologist, get
For
your
sure.
bloods done. And then there's so many treatments.
Yes.
There's HRT,
Yes.
so hormone replacement treatment, which I believe for my friends are very successful.
Yes.
And you don't have to suffer in this day and age anymore.
No, please don't.
But tell us about what you can do for menopause at home. What is your best advice?
So my best advice is to live a healthy life. So you need to, obviously, if you can manage stress, it's not as easy, it's easier said than done, but that is definitely something that you need to concentrate on. Get enough sleep if you can, or ask for help if you're not sleeping enough. You need to drink enough water, you need to eat a healthy diet. It's all about the basics. And then exercise really plays a very important role, even in the hot flashes and the fatigue that you're experiencing after or during perimenopause. It really helps to do all of these things also, not only by adding hormones, but the conservative things make a big difference.
Yoga, weights.
Weight training is very important after menopause. It helps with your bone density and overall well-being.
And consuming less alcohol.
Oh, that's definitely also another one. Yeah. Definitely.
I want to know, because I'm only looking at getting my menopause 50 years from now. So
When she's 40.
I'm always so interested to find out, like, what's the duration of menopause, right? Or does it carry out like till you're like 80? Because, teenager, you have periods all the way till like...
That's a very good question.
So I'm always like, how long is this phase going to take? Because I'm too old for it.
It's very different for, everyone. I've never seen somebody that says to me, it lasts a year, and then the next one also will say that. It can really differ from person to person. Usually we say, if we're looking back at the last period, if you've not had a period for 12 months, you've now officially gone through menopause, right?
Okay.
That's sort of the definition. And then your symptoms can persist for a year or two. Some women have their symptoms persist for much longer. Some don't have any symptoms. So it's very difficult to say. There's not a direct guideline as to say how long, we will have to see.
What's the longest case then?
It depends, probably 5 to 10 years. But in
That's very uncommon.
no, but
Denise.
that's uncommon.
Really
And
is.
also, we definitely supplement, you can treat the menopausal symptoms.
Okay.
So it's not that you're going to suffer for 5 to 10 years. There's something that we can do about it.
It's
So
manageable.
Definitely. And then
Okay.
you don't have the symptoms if we give you treatment.
Because I'm a unicorn. I might be the 10-year case.
No, I don't think so. The other thing I want to say about hormonal replacement, just a very important thing, is in the past 10, 20 years ago, they thought that hormonal replacement therapy causes breast cancer. But that is not the truth, okay? If you have your screening mammograms on board, you have normal breast exam, you can safely use a hormonal replacement treatment without really fearing that it will cause breast cancer like people used to believe. So it really has a good place. Of course, if you're a breast cancer survivor, that's a different story, but that we can also go into another discussion, because that's a very long discussion about, HRT.
Okay.
But it definitely has its role in the right patient.
It's wonderful how far we've come, and that nowadays you don't really have to struggle through menopause on your own.
No.
There's so much innovation around it. We've grown so much in the field of gynecology. What treatments in the future in the field of gynecology specifically are exciting you?
I'm so excited that we've moved in gynecology surgery from open surgery, where we make big cuts for a hysterectomy or even removing a cyst, where we now move to minimal invasive surgery or laparoscopy or keyhole surgery, as some people would call it. And that's a procedure where it's just the way that we do the operation differently. We don't have to make a big cut that, increases your pain and recovery time. We do the whole operation through small little 1 centimeter incisions on your tummy, and we put in a camera lens and a different one, and we can do the whole procedure like that. And it really helps the patient to recover quicker. You have less wound complications, less wound infection. The patient go home quicker from the hospital. It's really great. And even more exciting on top of that is we're moving towards robotic surgery in gynecology, where it's not the robot itself that's doing the surgery. It's still a surgeon sitting there, but it's next to the patient, managing the machine and operating. And it actually is now seen to cause less complications during the surgery, and also has all the benefits of quicker recovery time, less pain afterwards.
Absolutely incredible.
It is.
I think knowledge is power when it comes to, the menstrual cycle, menopause. Is it true that you are uglier just before your period?
I don't think so, but some people feel that way. And if you feel that way, then maybe. But you do feel worse because of that progesterone predominance.
Symmetry,
And you feel bloated. Yeah,
and-
definitely. Yeah, and you feel
And I think
tired.
just understanding, the process when you're at your peak performance for work,
Yes.
for your relationship, and understanding when you shouldn't be putting yourself under pressure, whether you're in menopause or you're premenstrual.
Yes.
It's a wonderful era where we can have these discussions.
Yeah.
We can be open about them. We're normalizing it. And the modern man is so on it. I mean, I know
Yeah.
my husband is so on it.
And that's so great.
And it's so great. It
Yeah.
really is changing the game, and it's making relationships really great. It's improving relationships.
Definitely.
So thank you for all your insights.
Thank
It's
you.
It's a big
Really,
pleasure. Thank you for
yes.
having me. Thank you so much.
Denise is only having her, menopause
Yeah, it's
in
going to be a while.
20
Don't
years.
worry. I'll be there for you.
for everyone else, we learned a lot. Thank you,
I'm so
Dr.
glad.
Celeste.
Thank you very much.
That's it from us at Beauty Talk. See you next time.